Module 1. Improving Patient Safety. In the healthcare environment, tubing misconnections are an all-too common problem that can have serious consequences. The universal port has been a factor in many of these misconnections because it makes closed systems IV compatible, increasing potential user error. In 2006, leading healthcare organizations recommended that manufacturers redesign their products to reduce the risk of error. To help address this problem, Nestle Healthcare Nutrition introduced the SpikeRight system in 2008. The SpikeRight system is a uniquely designed enteral spike and matching enteral-specific port for closed system containers that helps reduce the risk of IV connection errors. Nestle's SpikeRight system features a threaded port that is designed to accept a screw-top companion spike set. The SpikeRight system's safety record speaks for itself. Of the more than 270 million SpikeRight products sold worldwide, only one proximal end misconnection has been reported with this product, and that occurred when the system first launched in Europe during the mid-1990s. With an ongoing commitment to patient safety, in 2011, Nestle launched the next-generation design for closed-tube feeding systems, the SpikeRight Plus connector system. It was incorporated into the next generation of compact administration sets in 2011 and UltraPack containers in 2012. The SpikeRight Plus connector system improves on SpikeRight products' already impressive patient safety features and performance. As of 2013, it has become the common industry solution for lowering the risk of tubing misconnections for the proximal end of enteral feeding systems in North America. The SpikeRight Plus connector does not fit into an IV bag port. The SpikeRight Plus port does not accept an IV spike. Here's how the SpikeRight Plus connector system helps protect your patients from the risk of tubing misconnection. The SpikeRight Plus proximal end connector has a cross-shaped tip that is compatible only with the corresponding slots on the threaded port of the feeding container. The connector slides snugly into the slotted threaded port. Inserting the connector into the port completes a connection that is secure and designed to reduce the risk of misconnections with IV tubing or other equipment. In 2014, the enteral industry will initiate changes to the distal end of enteral administration sets, and later to feeding tube ports. These changes will lower the risk of misconnections at the distal end of the system. Together, we make a critical difference in improving patient safety. For more information about the SpikeRight Plus connector system, please visit www.nestlehealthscience.us or call us at 1-800-422-ASK2. Module 2. UltraPack Bag with SpikeRight Plus Connection Instructions. Before we begin, remember to always follow your institution's policies and procedures for safe feeding practice and refer to manufacturer's instructions for use for all equipment you may use. Nestle's SpikeRight Plus connector system is designed for ease of use. For this demonstration, we'll use an UltraPack bag with a SpikeRight Plus port and an Entralight Infinity pump set with a SpikeRight Plus connector. Follow these same instructions when using any SpikeRight Plus compatible pump set. How to connect instructions are printed on the back of each UltraPack bag for your reference. Before you begin, take a moment to check a few things. First, make sure the UltraPack product name matches the physician's orders. And check the expiration date. If the package has been opened or damaged in any way, don't use it. Shake the UltraPack bag. Visually inspect the formula. It should be uniform throughout and stay in solution. Fill in the patient's name, room, date, feeding rate, start time, and your initials on the label. Wash your hands. Throughout the process, be sure to use clean technique and avoid touching the end of the connector. This can introduce bacteria into the formula and contaminate it. Hang the UltraPack bag on an IV pole with the label facing forward and remove the small purple cap. You may need to pull on it gently. Next, open the administration set package. Make sure the tubing doesn't touch the floor. For this demonstration, we'll use an Entra-Light Infinity pump set with a SpikeRight Plus connector. If you are using another administration set that has a clamp, you need to close the clamp before attaching the set to the bag. Remove the clear cap. This will expose the connector. Again, to avoid introducing bacteria into the system, don't touch the connector end or let the uncapped connector touch another surface. Insert the end of the connector into the cross-shaped opening in the port on the bag. Turn the connector's collar clockwise until it's securely fastened, and then turn another half turn. You have now connected the bag to the set. Follow the pump manufacturer's guidelines to begin your feeding. Thank you for taking the time today to learn about the SpikeRight Plus connector system. If you have questions or comments, please visit our website at www.nestlehealthscience.us or call us at 1-800-422-ASK2.